MAC because it's so neutral.
So pretty.
And then I have a little bit of lip gloss. I'm
Oh my gosh.
junky.
That's a
Thank you.
Like it.
Alrighty.
Ready?
Yeah.
Rolling?
Nikki, just scooch a little bit closer to Mar. Perfect.
Okay, remember how it goes, right?
I think so. Are we doing another of the thing at the end?
Yes.
I was just thinking like, oh shit,
Yeah.
do I have a new one from last time? Okay.
Take your time. Give me anything.
Okay.
Let me know when you're ready.
Okay.
Good?
I
Okay,
think so.
awesome. Hey everyone, welcome back to Meet the Experts. I'm your host, Mariella Pepin, and today our expert is...
Hi, I'm Nikki Spano, licensed esthetician and laser technician for 18 years. Thanks for having me back.
Sorry, I'm gonna have you move that a little bit closer to you, the mic.
Oh, move it
yeah,
this way?
yeah.
Okay.
There we go.
Like that?
Yep, that
Okay.
should be good. Okay, we're gonna do
Redo?
that again.
Okay.
Even a little bit closer.
Closer?
Yeah, there we go.
Good?
Yeah, perfect.
Okay.
Okay, here we go. Hey everyone, welcome back to Meet the Experts. I'm your host, Mariella Pepin, and today our expert is...
Hi, my name is Nikki Spano, licensed esthetician and laser tech for 18 years.
Awesome, thank you for being here, Nikki.
Thanks for having me back. I'm excited to talk with you about a popular treatment that's in season right now. It's a perfect time.
Okay, so it's IPL and BBL, right?
Yes.
All right, let's start with what is the difference between these two?
Okay. So IPL stands for intense pulse light and BBL stands for broadband light. They're very similar light therapy devices, but they actually have a few differences that are really important. So IPL has 3 wavelengths and BBL has the same 3 plus 3 more. So it has 6. So it really kind of allows you to customize the treatment. It also has another key point where the IPL has a sapphire crystal. So the motion is kind of a stamping on the skin. With the BBL, they have something called smoothie adapters. So it allows you to kind of customize the size and glide it on the skin. So it actually feels way more comfortable and kind of eliminates a little bit of the striping that you can get sometimes with the IPL.
Interesting. Okay, I want to go back to this wavelengths.
Okay.
So why is 3, okay, I don't want to say better, but like
Elevated.
elevated. Okay, so what is the difference in elevation, let's say, between 3 and 6 wavelengths?
Okay, it's a great question. So IPL has been a staple. It's been around for decades. The 3 wavelengths is effective for browns and reds in the skin. So your background redness, broken capillaries, signs of rosacea, sun damage. I would say safe between maybe Fitzpatrick's 1 through 4.
Okay.
What Sciton really did with making an elevated device and having those 6 wavelengths is it allows you to customize a little bit more of what you're treating at those different layers in the skin. It also opens up from Fitz 1 through 5, so you can also have a little more flexibility with different skin types to really kind of hone in on what their goals are.
Okay, love this. I love the science behind all this because as a patient or as a client, I don't necessarily know. I trust the provider to know exactly all the little differences. So
Sure.
it's cool getting to hear this side of it. So thank you.
Absolutely.
Okay, so let's talk about why now is a good time to do these lasers. Why is it better to do them, let's say, in the fall than in the summer?
So I would say fall and kind of winter is really IPL, BBL season because you really can't be in the sun and it's really a contraindication for the safety of your skin that you do not have a tan or any sort of residual tan, and that includes any sunless tanning like lotion, sprays. Also, there's a little bit of some healing involved. I would say it is kind of a go back to work treatment, whether you do an IPL or BBL, because you could put makeup back on the same day.
Okay.
However, especially if you're treating the body, like the chest, the arms, the back, what comes up to the surface, they look like speckled little coffee grounds.
Oh.
And it takes about 2 weeks on the body to come off.
Okay.
So it's sweater season, we have our jackets on, our
Yeah.
scarves, so it's much easier to kind of camouflage and allow that process to happen naturally. And then you don't have to worry about kind of hiding out from the sun.
Okay, awesome. Love this. Okay, I have kind of a multi-part question. Who is the ideal candidate for each one? And is there a world where someone might be a candidate for both?
So with that question, I would say the IPL, you really are looking for your lighter Fitzpatrick's. So typically 1 through 4. Anybody that has concerns with rosacea, sun damage, that really their goal is to even out and balance kind of that bright skin tone.
Okay.
For the BBL, similar, but you have a little more flexibility with the Fitzpatrick, with being
Okay.
able to treat a little darker Fitzpatricks 1 through 5. They're both great. I would say it's really kind of the one that's available.
Okay.
Yeah.
Awesome.
I mean, we have both devices at Spa Derma. It's just the BBL is going to allow you a little more flexibility to customize.
Okay. We can cut this out if not, because I'm going to ask about like safety. Is there a difference in safety between the two?
Safety across the board really would be your contraindications. We don't treat when you're pregnant or nursing. Antibiotics, especially photosensitivity, and then absolutely no sort of sun.
Okay, got it. Before and after, right?
Correct.
Okay, perfect. Is there anything else you wanted to touch on for either of those? Anything we missed?
I mean, that's kind of the basics. I don't think so.
We talked about the difference, fall treatments.
We could talk.
Oh, sun damage. We didn't mention sun damage specifically, right? Did we?
We can circle back to that because one of the main things it targets.
Bye, thank you.
Bye.
Okay, yeah, so let's mention the sun damage, and I think that's it.
Okay, perfect.
So another reason this might be good for post-summer is because it can help with sun damage, is that right?
Absolutely, and that's part of the reason why this is a perfect time to do it, because even though you may be cautious about wearing your sunscreen, your hat, and not necessarily maybe a sun bather, but once you have sun damage, unfortunately you always kind of do. Think of the skin as like memory foam mattress. It kind of remembers where that pigment is, and a little bit of some sun kind of brings it back up to the surface. So the IPL or the BBL is a great way to kind of refine and freshen that back up. And then you can get possibly 2 to 3 sessions in. We typically space them out about 4 to 6 weeks apart. And then that puts you right in time for the holiday parties and
Yes.
pictures, and you're glowing and your skin looks great.
Oh my gosh, okay, so after this, is there any maintenance that someone might want to do or have to do?
Absolutely. I would say across the board, with any corrective treatments, it does require some maintenance. You can do typically a series of 3 to kind of get started, and that way we can kind of get it as light and bright as we can and keep things minimal, and then maintenance would maybe be quarterly.
Okay, love that. That's a good timeline.
Absolutely.
Well, thank you so much, Nikki. And before we let you go, we do like to ask all of our guests to leave our audience with a little tidbit or some advice or a motto.
Okay.
What would be yours for today?
Well, since we're talking about IPL and BBL, 'tis the season, and I feel like when you look good, you feel good. So treat yourself. It's the perfect time to do it.
Love that. Thank you so much. And
Thanks for having
thank you for tuning in. We will see you next time on Meet the Experts. In the meantime, don't forget to let us know what topics you'd like us to discuss next. And make sure you follow, like, comment, subscribe, all the things. Bye.
Bye.
Cute.